Welcome back. Now, the Ministry of Health and Social Services launched the Ministerial Service Charter yesterday in the capital. Now, according to the Minister of Health and Social Services, the charter is aligned and guided by the high-level statements, namely their vision and mission. The implementation of the undertakings in the Public Service Charter aims to effectively steer this institution towards excellence in customer service. Now, with more on this, the importance of this charter, I'm now joined on the line by Dr. Kalumbi Shangula, Minister of Health and Social Services. Good morning, Doctor, and thank you very much for making time to speak to us this morning.
Good morning, sir, and good morning, Namibia.
Minister, talk to us about the launch of this Ministerial Service Charter. What is the aim and objective behind it?
The launch yesterday of the Customer Service Charter of the Ministry of Health and Social Services is the culmination of a long journey, a consultative process to develop the Customer Service Charter for the Ministry of Health and Social Services. This is a very important tool which is aimed to improve public service delivery in the Ministry of Health and Social Services. It has been a consultative process involving a lot of stakeholders and customers who are actually the consumer of the service of the Ministry of Health and Social Services. It is intended to prescribe the conduct of staff members of the Ministry of Health and Social Services in their interactions with patients and clients alike.
Okay. Now, Minister, in terms of this service charter being launched, do you believe that it will likely lead to the improvement of services in terms of the service that you provide, especially that you're talking to say that the immediate target in terms of this charter is those that make use of the services of the ministry?
Yes, indeed, because we have seen that sometimes the public is complaining about the conduct of our staff members. So we took those criticisms, those complaints, and then said, how best do we address this? And therefore, they have been addressed through the development of the charter. Now, the charter prescribes to the staff members how should they behave in their interaction with the public. It also imposes commitments to the staff members. For example, I can give you an example that if somebody is phoning a certain office, that call must be answered within 3 rings and not more. In other words, the caller must not be allowed to wait for a long time on the line before the call is answered to. So these are all issues which we have picked up from our interaction with the public, the complaints, etc. And these are the ones we are addressing through the Customer Service Charter.
Okay. Now, it's good that you talked about this, Minister. The question that perhaps which is important, how will the ministry ensure that its staff abide when carrying out their mandate in terms of the content that is in this ministry? What are those modalities that are in place to ensure compliance?
In each directorate, in each unit of the ministry, there are champions. Champions have been appointed to ensure the compliance and the implementation of the charter.
Now, the implementation of this undertaking of the Public Service Charter aims to effectively steer the ministry towards excellence in customer service. It's one thing to have compliance, but it's another thing to do the issue of monitoring mechanism. Do we have monitoring mechanism to ensure compliance and obviously consequences for non-compliance, even though you have those champions that have been appointed?
Yes, indeed. There is an inbuilt monitoring and evaluation that tracks the implementation and the compliance. I must also mention that As much as we are focusing on the staff members who are serving the public, as it is said, it takes two to tango. There is also an expectation on the part of the public when they are interacting with our staff members. I must emphasize the fact that, especially in the hospital settings or clinic settings or health center settings, it is a very stressful environment where staff members sometimes are overworked, where staff members are seeing a patient who came in and the person is passing on. It is a very stressful situation. And staff member as human being, it also affects them. There is nothing more depressing than seeing a patient exit from this earth. Because our goal is to ensure the health and then that everybody who comes to us goes out as a healthy person. And those are some of the stressful environments which are associated with the work of the health workers. And therefore, also, we ask that the public has got that understanding and not unnecessarily provoke the staff members into a confrontation.
Okay. Now, Minister, we understand that the ministry has also started to implement the health facilities quality standards with the aim of ensuring that standards of service across the board are improved. Talk to us about the progress of this initiative.
Yes, this is indeed, it is one thing to be kind to the clients or to the patients, but it is also quite important to ensure that the service that they receive from us is a quality service. We have units within the ministry which are called the quality assurance. These are in each and every hospital to ensure that the quality, the service which is given to the clients and patients, the quality is assured. Because it's only through quality then we can improve the condition of our patients and clients.
Now, let's talk about how the public can be able to access this service charter and where they can get more information about this charter.
In all our health facilities, we have custom service desks. This document is a very handy one, small, easy to read. They can be. We are now distributing them after the launch to all our facilities, and any member of the public can go and ask to get a copy. So that it is also important that the public has got an understanding as to what is expected when they get to the health facilities, what is they expect to find. So that also when there are shortcomings, they must demand that according to the charter, I'm entitled to ABC and I want to get that ABC.
Now, Minister, before we conclude our conversation, we also understand that the Ministry of Health and Social Services has created an additional 11,400 positions of new employees you envision to recruit.
Yes, indeed. The staff establishment of the Ministry of Health and Social Services was determined some few years ago. But as we know that the population of Namibia has increased, as we have seen during the last population census. The disease profile has also changed. There is much more demand for health services. And therefore, it is important that we are addressing the current situation. We have approached the Office of the Prime Minister, which has graciously agreed and approved 11,000 plus additional posts. And we are now currently busy with the recruitment. And for your information, I can also inform you that just recently, we have recruited an additional 40 doctors for the Ushakati Hospital, and then a equal number of 40 doctors for Katutora Hospital. We are also trying to address the question of long queues, patients having to wait for a long time before they can be seen by a doctor. We are also aiming at improve the quality of service.
Doctor, thank you very much for making time to speak to us this morning, and we hope that all these efforts will indeed lead to improve service, especially at the Ministry of Health and Social Services, considering the important services that they provide to the Namibian nation.
It's my pleasure, and thank you very much.
Now, that was Dr. Kalumbi Shangula, Minister of Health and Social Services, talking to us about the ministerial charter that was launched yesterday in the capital, and also indicating that the ministry has been granted permission by the Office of the Prime Minister and Public Service Commission to create positions over around 11,000 and plus, and also recruited more than 40 doctors recently that were dispatched to various hospitals. Stay tuned. We'll continue more conversations after this break.